it's kidney disease that shortens the life so much. A younger person that has diabetes, especially if they have evidence that they might be developing kidney disease, that's someone you really want to be aggressive with, because you don't want them to develop kidney disease. So you may want to do a pancreas alone transplant in that person. So the 30-year-old that has protein in the urine already, although the creatinine might be normal or just a little abnormal, that's somebody you want to try to do a pancreas alone transplant. Now, the person that has both, that has kidney disease and diabetes, you could be a little bit more liberal in what you will accept as far as age goes. But again, the way I look at these patients, if they're already in their 50s or beyond, is, are they healthy enough to undergo such a big operation? Because a kidney pancreas transplant is a big operation. So you have to be healthy enough to make it through that operation. Yes, ma'am.
Hi there. I'm curious if you have any good statistics for us on the incidence of kidney disease between type 1 and type 2 diabetics.
Yeah. The percentage of people with kidney disease that are type 1 diabetics is much smaller. However, what you have to realize is, the type 2 diabetics make up such a much larger percentage of people that have diabetes, number one, and that are going to be people with kidney disease. So when you look at the number of transplants that we do for type 1 diabetes, it's quite small. Only about less than 10% of those patients are going to have type 1 diabetes, whereas the majority of those patients, and now diabetes is the most common reason to have kidney disease, the majority of those patients are going to have type 2 diabetes. But if you're talking about what percentage of type 1 diabetics are going to develop kidney disease versus what percentage of type 2 diabetics, then you start to look, it starts to be on par. The type 1 diabetics, especially as life goes on, are much more likely to have kidney disease just because of duration of diabetes. So it's more the duration of diabetes than really is type 1, type 2. And people, once they have more than about 20 years duration of diabetes, that's when the incidence of kidney disease starts to go up. This is particularly problematic in type 1 diabetics just because they tend to get diabetes when they're children. So they don't tend to have good control for many years just because of the nature of being a child and having diabetes. So usually what will happen once these people hit their, and then they have this honeymoon period also. In other words, they don't pay a cost for not being compliant in their teens. They start to pay that cost in their 30s and 40s. And even though they may get very compliant in their 20s, the damage has already been done. That's going to happen down the road. So it's really a nature of duration of diabetes. Yes, ma'am. Yeah, so that's another form of beta cell replacement, and I will tell you, it's in the armamentarium. It's going to be very interesting. But even the artificial pancreas, at least the way it's being conceived now, is mostly an insulin replacement therapy. For it to be even more successful, you would need both, or at least more of the hormones to come from whatever the structure is, glucagon as well as insulin, to keep you euglycemic. Because it's the younger you are, or the less duration you've had of diabetes, the more successful these sorts of therapies can be for you. Like the young person that starts on the insulin pump, likes the insulin pump and does everything they're supposed to, that person has a much less of a chance of developing complications because they've started younger in life and they don't have the autonomic dysfunction. So then they don't get the big dips in their blood glucose level. It's patients that have developed this autonomic dysfunction that's going to get those dips that no form of insulin therapy is going to be perfect for them, because they know, and you guys figure out, my patients are smart. You figure out, yeah, it might make more sense if my hemoglobin A1C was 6, if my blood sugars stayed around 120, but I feel crappy. So I'm going to let it be around 150 or 160. I'm going to feel better. Well, what your body's telling you is that it doesn't like those drops, right? And the reason why your body's telling you that is because you already have some autonomic dysfunction, and it's not able to kick in the glucagon to push your blood sugar back up. And those are the kinds of patients, when they start to develop those kinds of things, that I will see them and I will start to think that you might be a candidate for surgical option, because at present, the only option you have to push you back into euglycemia is a pancreas transplant. Yes, ma'am.
Does the body reject that like it did the island?
Yes, very, very good question. And the answer is yes, that can happen. In other words, pancreas transplant is not a cure for diabetes, because whatever caused your diabetes can recur. However, the medications that we give to keep your body from rejecting the pancreas also will work in keeping your body from recurring diabetes, because it's a very similar process. The same type of process that makes you reject organs, the same cells that are marshaled in like an army, are the same cells that cause you to become diabetic in the first place. So the medicines that we give to push back on the immune system work for decreasing rejection, but it also works for decreasing the recurrence of diabetes. For matter of fact, there are some experimental protocols where the same medicines we use for transplant, people are using them now as a treatment for diabetes. So young people that develop diabetes, or when they first get diagnosed, they will take immunosuppressive medications in order to decrease the chance of their diabetes getting really badly quickly. And they found that to be very successful. So there's a lot of research going into using those kinds of medicines even before a person gets transplanted. In Europe, they've done lots of these studies, because there's some families in Northern Europe where there's 100% penetrance of diabetes. In other words,